The goal of the healthcare team is to deliver patient-centered care to all of our patients. The role of a pharmacist on the healthcare team is to help achieve that goal as it relates to medication. So pharmacists will assess regimens and orders, will make recommendations, and hopefully in doing so, will ensure that the patient receives appropriate care, effective care, and safe care. And if we do our jobs, then we'll see an increase in outcomes, an increase in the likelihood of adherence, and hopefully an increase in the quality of life of our patients.
The role of a pharmacist on an interprofessional team is to be the drug expert and a reference for your providers, whether they are physicians, nurse practitioners, nurses, social work, and PT. I really see a pharmacist as the glue that holds the treatment team together and to keep medication outcomes at the center. Also, pharmacists on the team really serve as a patient advocate. So sometimes we see things that others don't see, whether it's a literacy barrier or adherence as it relates to cost. So I would say those are the two big roles of a pharmacist, to be the drug expert on the team as well as the patient advocate.
When it comes to training student pharmacists, school puts a huge emphasis on professionalism, starting from presenting ourselves professionally all the way up to being a professional yet personally caring bridge between patients and physicians, nurses, insurance companies, and most importantly to the medication. We are trained to be the reliable yet easy to reach healthcare professional within community, hospital, or any healthcare systems to support the optimal patient care outcomes.
I think that it is very important that pharmacists are readily available in underserved communities for several reasons. First off, I think that patients in this area may not have a means of transportation to get to the bigger cities where they can have doctor's appointments as often as they need to, or also they may not be able to afford it. Pharmacists are one of the most accessible healthcare professionals that we have. So I think that whether it be in a community setting or an ambulatory care setting, pharmacists can be useful in this way. We can help manage their disease states such as dyslipidemia, hypertension, or even diabetes.
We are the Samford chapter at Samford University's McWhorter School of Pharmacy.
And we are connecting the pieces one patient at a time.